Partnering with family caregivers and patients and residents was already a strategic focus in our strategic plan and a principle of how we would conduct our work. What this allowed for us was an opportunity to embed evidence-based practices on how you do that and to leverage the Change Foundation investment and resources to accelerate that work.
Too often, patients and families are engaged at the end of projects, really for staff to get approval once tools and resources are already developed. So it's so important that we're engaging patients and families at the beginning to ensure that we are creating materials that are meeting the needs of the patients and families. So it was really important for this Changing Care initiative to use a co-design approach where we're asking patients and families, what do you want? What gaps can we fill? How can we help you? How can we improve your experience? And then work together to create those materials that meet the needs of patients and families, as well as meeting the needs of staff. So we're doing this in partnership with patients, families, and healthcare providers.
We're an organization that serves a variety of patient populations, from mental health to rehab to long-term care to acute ambulatory care. So the context of how to meaningfully engage a family caregiver in each of those areas brought its own uniqueness. Some assumptions we might have made about how things should move forward got changed quickly because family caregivers would tell us, yeah, no, that's not really going to work for us. That's not how we want to receive information. We're now engaging family caregivers in the work we're doing that's been accelerated around virtual care. The beauty of the virtual is they don't have to travel. You can have their family caregiver who may not be in the same physical location as a patient there, as well as a patient on a call with the caregiver. That works for everyone and still achieves that same outcome. We took the opportunity not just to focus in one specific area, but to spread across our various patient care areas. We didn't see it as an initiative. We saw it as a way to accelerate and enhance something we were already doing. We saw the importance of continuing to focus on recruitment of care partners, of ensuring that we're keeping our education and training up to date, and to keep connected to those care partners and family caregivers in meaningful ways so that we don't lose the traction that we've already gained.
We had a foundation of working together with our patients, and bringing the caregiver voice to the table has been really an important addition to that, but it's built on a foundation of trust and it's built on a foundation of collaboration. Our vision at St. Joe's is to earn complete confidence in the care we provide and make a lasting difference in the quest to live fully. Our vision is defined by the people we serve. Have we earned their complete confidence or not? And that includes our patient and their family members, however they define family. And that's something we've been paying attention to for a number of years. And so this project was so complementary both to our vision, our strategic directions, and how we want to be as we serve people in our community, in our region, that it was a wonderful fit for us.
We were able to engage patients and families in a way that was meaningful to them. This is the first time they've been involved in a project like this, where they provided feedback and input and can actually see their feedback and input being used to make a change. We implemented a care resource binder. We launched a family presence policy. We created a new care partnership office. We implemented e-learning for healthcare providers across the organization. So as a team, we did achieve what we set out to achieve.
I was so impressed by the willingness to commit the time they did to this. Like individuals who sat on our steering committee for 3 years, to members of the co-design team, I was amazed at how much of their own time they would commit. So a huge thank you to our family caregivers who invested their time and energy, and to our patients and residents who invested their time and energy in this. And I would say the team who really championed this on behalf of the organization.